My name is Emil Morgan. I'm the clinical lead for the Shine Centre at Bolton, and I'd like to welcome you to the Shine Centre. And by the way, Shine Centre is sexual health integrated, not judgmental, and empowering. And what I'm going to do is, I'm being asked so many questions by our patients, what happened to them when they book for an appointment, when they come to the clinic. So I'm actually going to introduce you to one of my senior nurses, Julie, and we'll go through the patient journey.
Well, the first thing that will happen is you'll come through the doors and you'll come into the reception and you'll see one of our clerical ladies at the desk here, and that will be your first point of contact. And we'll give you a form to fill in some details, and this is just your name and your address and what it is that you want from the service today. Just want to reassure that it's extremely confidential, all the information that you give us here at the service. The information that you put on the form lets us know who you need to see. So that might be a nurse or a doctor, whether you want family planning or sexual health, or whether you want to see one of our speciality doctors. You want to come through to the waiting room. Okay, so you'll wait in the waiting room here, and then one of our healthcare assistants will call you through to see the doctor or the nurse.
Hiya, I'm Catherine, I'm a healthcare assistant. Would you like to come with me? I'll be your chaperone today. I'll just take you through to the nurse or the doctor, any tests that you needed doing today, and I'll be with you all the way through.
And I want to ask you something. I've been frightened about this thing that it's going to be painful, or you're going to stick what people call the umbrella up there. Is that right?
No, that's absolutely not true. We don't use any umbrella swabs here at all. For a man, it's just a simple urine sample. And for a female, it's just a simple swab that you do yourself. It's very easy.
So as you heard from our senior nurse, if you're a male or if you're a woman, either of you will not have any pain. It's a painless process. You walk in and you will be using this couch to examine you and do all what is required, and then you will be sent out there to have a urine test, and we'll do also your blood test here in that room. If you're a woman, you'll be using this couch there, which is easier for the nurse or the doctor to examine you and to actually do exactly the same thing. There's no pain involved. The tests will be taken and sent to our lab.
We look after all the samples here in the lab. We make sure that those that need sending to other places get sent, and that's all done totally confidentially. We also look at the discharge under the microscope. By looking at them close up, we can treat them appropriately whilst you're here in the clinic.
The other things we haven't mentioned is if there are contraception need, and for that we need to speak to one of our senior nurses, and I might introduce you to Renata.
Okay, so if you come into our service, be identifying what it was you wanted, looking at what you needed, and then we would do a full assessment to see what was on offer, what we've got. Some people want to start the pill, some people want to have an implant, which is just a small sort of matchstick size implant that lasts for 3 years under the skin. Some people might want to have a coil. So we would do an assessment to see which was appropriate and which you could decide that you wanted to have, or your girlfriend, or whether actually you wanted to use condoms, and look about your planning for your contraceptive needs. And then after the full assessment, we would be doing that provision. So we would either be doing a procedure or we would be providing it, but we'd also be discussing your sexual health. So we don't just focus on the one thing, because it's something that you might not have thought about if you put yourself at risk of sexually transmitted infections, and we would offer you screening for sexually transmitted infections as well.
Okay, well that's excellent. What happens if I have a problem with a rod or an implant put in my arm, or if somebody fitted me with a coil and I can't find a thread as a female patient? What do I do? Do you have any help with that?
Okay, we do run the specialist service, and it's consultant led. We have scanning facilities that can identify for those women who can't feel the threads, so that we can find whether the coil is still in there, whether it's still in situ, and also whether the implant is there, so we can locate it, particularly if it's someone who needs it removing, because it does last for 3 years, and it might be that it needs removing and replacing, and we'd replace it under the arm. So we've got the facilities to be able to do that as well.
The second thing we need to talk about is HIV. And Renata is actually the HIV specialist nurse, and she will tell us what happened if you come unworried about HIV.
Okay, so we sometimes get patients that come through our clinic and they've been tested for sexually transmitted infections, and like you say, one of those tests would be for HIV. And we're ideally placed, because it is an integrated service, that if we do get someone that comes through and it's a positive HIV infection that we're seeing, that we can see those patients within our own setting, so they don't have to be referred to anywhere else. So they're seen by a consultant, they're seen by myself, and we talk them through the next stages of the management and the treatment and the care that they're going to have in the future.
Okay, so you walked into the room now where we actually see our HIV positive patients. Basically, when you're diagnosed as an HIV, you'll be seen by our senior HIV specialist nurse, and you will be given the results, and she will discuss loads of things about your diagnosis, make you feel at ease, and also give you some support in terms of she might direct you after we finish with you here to George House Trust or the LGBT or whatever is required to actually give you support during that time with the diagnosis.
Really what we're saying is that we're providing a service for everybody that encompasses all sexual health and reproductive health needs, including HIV, under one roof.
We welcome you in Bolton Shine for sexual and reproductive health anytime. We really look forward to see you in Bolton. Goodbye. Bye.